Greetings everyone. I am Sajil Fatma and on behalf of Vaccination Society, I would like to welcome you all for today's webinar. First of all, I'm so grateful that all of you took out time from your busy schedules for being with us today, especially our glorious Vice Chancellor, Professor Dr. Naseem Ahmed, our patron, Dr. Anila Zamir Dorani from UVS Lahore, and our guest speaker, Dr. Ajaz Rashid from East Windsor Animal Hospital, USA. Being the host of this session, I will begin it in the name of Allah, who is the most gracious, the most merciful. So I would like to invite Hafiz Muhammad Shakir for the recitation of Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وكذلك أوحينا إليك روحا من أمرنا ما كنت تدري ما الكتاب ولا الإيمان ولكن جعلناه نورا نهدي به من نشاء من عبادنا وإنك لتهدي إلى صراط مستقيم صراط الله الذي له ما في السماوات وما في الأرض ألا إلى الله ألا إلى الله تسير الأمور صدق الله العظيم.
Jazakallah. Today we are here to continue our series of evidence-based medicine. Experience from the previous session, Dr. Ajaz will instruct us about the basis of diagnosis through real-time cases. That how diagnosis is carried out step by step in US. We can estimate the importance of correct diagnosis, that it can improve the effectiveness of treatments and avoid long-term complications of the infected patients. Early diagnosis can also help to prevent or stop an outbreak. First part of this series gained so much appreciation from the audience, and I'm sure that such unique and extraordinary approach of diagnosis elaborated by Dr. Ajaz will take the minds of participants to the heights of competency and perfection. So for inaugurating our webinar, I will request our glorious Vice Chancellor, Professor Dr. Naseem Ahmed, to have some words with the audience.
Assalamu alaikum, Dr. Ajaz Rashid Sahib, the source person, the invited speaker today, Dr. Anila Zamir Durrani, our professor of veterinary medicine and also the patron of Vaccination, all the office bearers and members of the Vaccination Society. and all a huge number of, I see 140 so far, students or faculty or interested vets in this webinar. Assalamu alaikum and very good evening from Pakistan. And Dr. Sahab, aapke liye good morning. I appreciate the time on Sunday morning. It's only I was part of the first series which Dr. Ajaz Sahab talked about, and it was so interesting and inspiring, I would use the word, that I asked the organizers to perhaps whenever look for another opportunity. And although he's not into a teaching, but I think he was the best teacher I have in my own experience last 2.5 decades into teaching, but this was outstanding. And let's hope that today is even, he sets the bar even more high. जैसे एक किसी किताब की पॉपुलैरिटी का इंडिकेटर होता है कि उसके कितने एडिशंस आए हैं, तो मेरा ख्याल है कि ये पार्ट 2 डॉक्टर साहब ऐसे ही लग रहा है जैसे ये भी एक बड़ी पॉपुलर सीरीज है, और इसको हम ये वेट क्रिसेंट के फोरम से, युवास के फोरम से इसको आगे और बढ़ाना चाहेंगे. I think number 2 point, we must appreciate that the small animal practice and evidence-based medicine, what we are learning today is the latest happenings in the developed country, a country like US, which is the highest standard, having been trained and lived in that country for about 8 years. So using this technology, this distance is, shortened, and it is an opportunity for all the young vets, the students, to get the latest in an outclass manner, how a case is diagnosed, treated, managed, and the satisfaction level of the client or animal owner. I think number 3 is it provides, this session provides a motivation or inspiration for the students and as well as the faculty to excel if Dr. Saab has reached this stage, and why cannot I? So I think it's a motivation and inspiration for the students to hear such a talk. With these kind words, I once again thank you, Dr. Saab, for his time, and all the organizers, Professor Anila, and students who have organized the part 2. Thank you very much.
Thank you so much, sir, for your kind remarks. I highly appreciate you for being so thoughtful. So without any further delay, I'll get to the part for you all have been here. The webinar of evidence-based medicine by Dr. Ajaz Rashid. Dr. Ajaz Rashid, who has 25 years of experience in medicine and surgery. He has worked in many leading positions, including managing a government hospital, was a head veterinarian at another hospital. He was so aspired to work in wildlife that he became the first veterinarian in the history of Asia to breed Royal Bengal tigers in zoo captivity. We are bound to time limit, but not his list of achievements. We are profusely overjoyed to have you with us, sir, again. So without any further ado, I will turn the time over to Dr. Ajaz Rashid.
Bismillahirrahmanirrahim. My most respectful Professor Dr. Naseem Ahmed, Vice Chancellor, US, and all other my most respected teachers, professors, and students and guests all over the world, please accept my regard. Assalamu alaikum. And I would like to special thank Professor Dr. Anila Durrani and Vet Crescent Society and their President, General Secretary, everybody who tried to arrange this seminar. And I would like to special thank also one of my classmates, retired Colonel Dr. Hamad Ahmed Hashmi Saab, who had a lot of contribute to organize this seminar also. Okay, and I think this morning I listened the ex PVMSC registrar interview. I feel very painful listening all the interview, and Professor Dr. Neela Durrani raised very good questions on that meeting. Okay, and I hope we should arrange more this type of interview and meeting, and how we promote our professional in Pakistan. I feel very bad when I'm listening about the young graduate, the unemployment ratio and everything. To be very honest, in USA, we have a shortage of vet. If I want to hire any relief vet or something like, I have a lot of difficulty. Even we pay right now the minimum per hour vet charge like $110 per hour. If they work like 8 hours, they can make $900. And still we have difficult to find a vet. To hiring a vet is very difficult. Even we offer bonus and everything. The major company, they offer like a 50,000 bonus also, but still it's difficult to find vet. What's behind of this? Is all like a society, AVMA, who making all the rules and regulation. It's very difficult to get admission in veterinary school as compared to the medical. But that's a long story. We can discuss this thing later on. We are here to discuss evidence-based medicine. The evidence-based medicine, as I discussed in part 1, that if you have evidence what you are treating and what you are dealing, then the outcome is based medicine is also depend upon your knowledge, your experience, and your observation. Your observation is the most important when you diagnose any disease, okay? And if you have very good observation, you can diagnose the disease right way. Anyone, any case incoming our hospital, to be very honest, I have my mind, what should I want to do and what is my diagnostic and what I want to, I think about the broad picture, then I go like a narrow, then I go like a to the point. I do the test like a to the point. It's not like I do like 100 tests and then I find out what is going on. No, we select very point to point. I think my associate, Dr. Gustavo is also here. He knows that my approach. We approach like a very special. We know everything before we go in the exam room when the technician explain everything about the history and everything. History is very important to diagnose the case. And also I give you some example. I'm not starting my lecture yet. We're gonna give you a few examples how you, with the observation, you can also diagnose the disease also, okay? This is the case. Nick is coming in our hospital.
Bring him back, okay? Bring him back.
Like history of the limping of the left limb, left hind limb. We walk in the hallway to see like how the lameness going on, okay? And what the owners say about this one.
How long did the pain have?
I've been noticing it. It just kind of started with the loud that noise yesterday.
When you pick up, you feel a lot of pain.
Yeah. And he was like making that noise even yesterday. He was doing it without me even picking him up. He was just making all these noises.
Okay.
Observation on the history and everything. The dog has like a lameness, limping on the hind limb. And when I check the physical examination, there's no CCL rupture. There's no any kneecap, any problem, anything. And I told the owner, we need to check only one test. It's called like a Lyme disease test, the 4DS test, to check like a tick-borne disease test before we go take any X-ray or any diagnostic test. The owner says, yes, go ahead. When we check the test, this dog is positive with the E. canis, like Archaea canis and the Lyme disease. So there's the cause of his lameness or limping. We send home with the medicine, doxycycline is the drug of choice, and we give the injection. The next day, the owner called back. They say, the Nick is doing wonderful. He's not limping anymore, okay. If we don't diagnose properly, and if we give like a pain medicine, all these things, okay, the Nick do not want to feel better, okay. This happen only when you diagnose properly. There's also a board question here, like is Lyme disease curable? No, the Lyme disease is not curable. Is it treatable? But it's not a curable 100%. It's coming back whenever the dog has a stress or something like it will be show again. Then we have to treat again. And sometimes the board, they will ask you this question also. Is the Lyme disease, is it curable? No, it's not a curable. All the tick-borne disease is not a curable, is a treatable, but it's not a curable. The other thing, this rabbit came to our hospital, is not eating. If you look at the teeth is very long because the rabbit, they constantly grow their teeth, okay, and we have to trim their teeth. The owner said, my rabbit is not eating for a couple of days, is not eating very well. The cause of not eating very well is the teeth, okay, and we need to trim the teeth. And after we have like a high-speed machine, and we trim the teeth. So we trim the teeth, okay, and after that, very next day, the rabbit is doing much better. He's feeling very happy. The owner say he's eating, drinking, everything fine. We send over the pain medicine also. That's the next case. I have to show you a lot of cases in this seminar. Let's see, okay, how many cases we can handle.
Nothing on the chest.
This is like
nothing on
a
the tail.
sugar.
She's not preening. She's not preening like she should. Yeah.
This is sugar. Is coming in our hospital with the reference of one of my client. He go like a 3 hospital, and the parrot has, the macaw has like a plucking feather. The other hospital, they give a lot of medicine, antibiotic, all these things. He's on like a 4 or 5 medicine, but still the owner says not feeling better. He still has that problem. The problem is that he has like a depression, anxiety, because change of ownership. He has, before he has someone, he owned this parrot, macaw. Then the new owner, when he coming like a new home, is a new environment, depression, anxiety, all this happened. This is due to separation anxiety. They're plucking all the feather and everything.
Her birds preen. She's not preening.
So we put like a anti-depression medicine. I give like only one medicine, fluoxetine. It's called like a Prozac also. It's available in human also they're using. And this is like a anti-depression medicine. And after putting on that medicine, and I think he's feeling much better. And very next day, after a few days, the owner gave me a call back, and she said that sugar is doing much better.
She's under the doctor's care. She has anxiety, and she has pulled her feathers, and he is treating her right now. Sugar is a blue and gold macaw. to make this clip so you guys can understand
This is the owner of sugar.
what's
Okay.
going on. She was from a home where she was taken care of. She's a rescue. She's my bird now. And she was in another home before the woman that had her, who was in a condo and couldn't keep her anymore because she was too loud for the condo, who loved her, but gave her to me in the interim. She was in a home where she was kept in a basement, and I would imagine that's where she developed her personality traits. But anyway, Dr. Rashid is taking care of her now, so she is presently under his care. And as you can see, she's pulled all her feathers on her wings. But Dr. Rashid has her on antidepressants right now. He's got her on Prozac, and it seems to be helping some. It's still early on, but I'm hoping it will be okay, you know. Other than that, she's got a great diet and she's doing good. And
so this type of case, you don't need to do a lot of diagnostic tests to know what's going on. Okay, your observation is very important. Okay, and if you have a complicated case, of course, you need all the diagnostic too to find out what's going on. Okay, there's another case, the Senate is coming in our hospital, is limping on the left hind limb.
Go back again.
Camínalo más rapidito, por favor.
Okay, that's okay, that's okay.
Dale.
That's my associate, Dr. Gus, also speaking Spanish.
Okay.
So when we check the test, the 4DS test, this dog has positive with anaplasmosis and the Lyme disease also. Sometimes they positive only one disease, and that's causing a lameness, limping. And all the tick-borne disease, they cause like a very severe lameness, limping with a giant pain. And most of the time I see there's 1 or 2 or maybe 3 questions in the board is coming about the Lyme disease, all about the tick-borne disease in different way. Let's we start like a proper case right now. The case 1 is a Bing Bong, is a 6-month-old domestic short-haired male cat, is presented in our hospital. The belly is standing. The owner say his belly, his abdominal cavity is going like a distended, and we don't know what's going on. Okay, it's very small, it's very young cat. I have no idea what's going on. Eating, drinking, everything's okay. This case, after physical examination, I told the owner, I need to take the X-ray to see what's going on. Okay, because without X-ray, we cannot know what's going on. The owner said, yes, go ahead, take the X-ray. Okay. When we took the X-ray, we see here, we cannot see here anything, all the organ, because there's a lot of free fluid in the abdominal cavity. We cannot see anything. And after that, I told the owner, we need to drain the fluid to see what's going on. Okay. The owner said, yes, go ahead. And then we put draining is the butterfly catheter.
We can give you a couple of days.
When the
After
drain,
draining the fluid, we can do
the
that.
fluid is coming back exactly, we see like FIP, is like a flying infectious peritonitis disease. FIP is a disease, is same thing like a coronavirus, but different. Okay. It's very common, we see in the shelter, we also see in the wildlife, in the big cat also, is very common. Is the same thing caused like a mild diarrhea when the coronavirus, but this coronavirus change the genetic material. When they change the genetic material, it become into FIP. When it become FIP, then there's no treatment. Feline leukemia, cancer of the white blood cell, FIP, AIDS virus, they don't have any treatment so far in veterinary medicine. The prognosis is very poor. we told the owner we can give you a couple of weeks, and after that we need to put him down. I think we put him down last week. This is a very interesting case. Libby is presented in our hospital June 18, 21st, limping from the front left leg. Very often we examine, we check the blood work look okay. The 4DS test, the same test we did in the previous patient, and we see is positive with a Lyme disease and E-Canis. We check the blood work is normal. We sent home with a Doxycycline and the pain medicine. After giving the pain medicine and Doxycycline, the blood work looked like completely normal. Blood work look everything normal, liver, kidney, everything normal. And we check like a urine is also not, is okay only. They have the urinary tract infection going on. Anyway, we're putting on the Doxycycline. I think we are okay. But the owner called me back. He said, Dr. Rashid, my patient, Libby, is still not doing very well. He's still limping. He's limping like a more often right now. I say, okay, bring back. We want to go ahead and take the X-ray. This is after X-ray is coming out.
Okay, go ahead.
Libby, come here. Come on. Come on, Libby. Good girl.
You see his front leg is like a swelling going on.
Come on, big girl.
Okay, that's it. That's it.
So I told the owner, we want to take an X-ray to see what's going on. Okay. When we took the X-ray and we see the bone, a lysis lesion on this shoulder joint by hair, then I would tell my technician, let's take the chest X-ray. When we took the chest X-ray, the picture is very clear. We see like all tumor cancer is spreading all over. To see if you look at the round, a small round donut shape, these are the cancer. The cancer is already spreading to the lungs. I think we discussed with the owner prognosis, everything. Chemotherapy is the option, but I think this tumor is spreading very fast and we don't have any option left. And this is the worst case, because if we catch this patient early stage and we amputate the leg, after that it will be okay. And amputation is also a treatment of choice in osteosarcoma. Most of the time, this type of, we call like a primary bone tumor, and osteosarcoma is the most common tumor we see in this category. We check like all the body X-ray to make sure that the tumor, where the cancer is spreading to other organ or not. The osteosarcoma, and we, according to looking all the X-ray, the lesion is very clear. This type of cancer is called osteosarcoma. This also coming in the board questions. What's the treatment of choice for the osteosarcoma if we catch in early stage, is not spreading to any other organ? And the answer is that amputation. If it's spreading in the leg, amputation is the best treatment. Radiation after that, chemotherapy, and still they cannot survive. They can survive for maybe 6 months, 8 months, sometime 1 year. Right now, I think the University of Penn, they are trying to making a vaccination for this type of osteosarcoma. They are still under trial, is not coming in the market yet. My third case is the most interesting case. Eva is present in our hospital. According to owner, everything's fine. Eating, drinking, everything's fine. She told me that, Dr. Rashid, I feel that Eva belly is coming like a bigger. I don't know what's going on, but I just want to know that what's going on with my patient, what's going on with my my dog Eva. And she's a 13-year-old. It is not like a young. I said, okay, let me take X-ray to see if there's any tumor and mass, anything. Okay. She told me that, yeah, go ahead. When we took the X-ray, if you look at the X-ray, you can see this big tumor by here. And we don't know where this tumor is coming. This is another X-ray. You can see like a big tumor. And there's also foreign body here, like a small. That's not a concerned hour because the dog is eating very well. The concern is this tumor is a big tumor. What's going on? Okay. Then I told the owner we need to check the blood work, ultrasound to find out what's going on. And she told me that that's okay. We checked the blood work, and I think my son forgot to pull the ultrasound report and the blood work. But the ultrasound report came back. The Ava has a left kidney, a big cyst, very big cyst. And we are worried about that. What kind of cyst is that? I tell my ultrasound doctor, Dr. O'Brien, my associate, to draw the fluid. We sent to the lab, it came back like a cyst. We're still not happy because we see this tumor is growing bigger and bigger. And what time, if we did not remove this tumor or cyst, it may be burst and the patient will be dying on the spot. We discussed all the options with the owner, and I told the owner, you can go ahead, go to the specialist to remove this kidney, because aftercare is a lot to check the blood pressure, everything, and he need like a 24-hour care also. The owner refused to go like any special hospital. She told me that, no, Dr. She, you can do it, and I trust on you. Please go ahead, remove this kidney. I'm okay. I said, okay, give me a week or 10 days. I need to discuss with my associate, with Dr. Gus, also with my team. And we need a couple of things before we do the surgery. I read everything before we do the surgery, to anatomy, everything. And after reading books and everything, we feel that, oh, it's very easy, we can do it. But when we go inside to remove this cyst, we see this cyst is very big. And the first thing I keep in mind that I have to deflate the cyst, okay? I have to drain the cyst first because I cannot see the kidney. Then with the suction pump,
Okay, good.
here's my associate also, Dr. Gus.
It's almost full.
Full already?
After deflate the cyst, we try to remove it slow by slow to see what's going on.
Yeah, that's what happened to anymore.
We go step by step, and there's a lot of video. If I want to show you like everything, it take a lot of time for you guys. Okay. You go like a step by step to see remove like a ligate all the vessels with the blood vessel sealer. And we also like the ureter, we have clump and suture with the abdominal wall. There's under cyst, we see like a very nasty tumor, and we try to remove like everything. After removing the kidney, she's in like our ICU recovery cage. I monitor him very closely with blood pressure, everything. And after like after 2 hours, she's standing up.
Very good, dog. Excellent. How long we did the surgery? Like 2 hours?
We did 2 hours.
This is the first case, and we all very happy and excited that the outcome is very good. It's feeling much better. This is like we discharge at home. After 3 hours, we discharge the patient. Okay.
Wait, there's a dog coming in.
Okay, just.
Ava.
He's very happy.
Yeah.
You can see his wagging tail, everything. This all happened because we have all the latest technology, blood vessel sealer and everything. To be very honest, when I'm doing this surgery, I recall my brother, younger brother, who has a kidney problem, who has the same things. And I feel very bad because my brother was bleeding 45 days in Pakistan. We find the best doctor, Professor Jamshed, according to research and everything, is the best urologist, best surgeon, everything. But they doesn't have like an up-to-date instrument. The way we handle with the blood vessel sealer, all these we're using like latest technique, and we are very strict with the sterilization, everything does not get any infection, anything. And look at after 3-4 hours, we discharge the patient very happy. And my brother was bleeding 45 days, and after like maybe a couple of days, he was expired. He struggled a lot, but I think there's a lot of negligence happened. And when I was there in Pakistan, and I asked few questions to the resident professor, believe me, they are very upset. They do not know even anything. Okay. And being a veterinary, they asked me that, are you a doctor? I said, no, I'm a veterinarian, but I work in USA. I do all these things. Okay. I know the blood work, everything. And during this surgery, to be very honest, I have a tear in my eyes that I wish if I know they doesn't have this type of instrument, I will take from my hospital. But unfortunately, the time is gone. The report came back, the same thing like my brother has renal carcinoma. It's very aggressive tumor, very fatal tumor. We discussed with the owner that please Eva need chemotherapy, but the owner declined. She want to opted alternate treatment. So we are giving like a Chinese herbal medicine, turkey tail, immune support, all these things to give happy and healthy life. Of course, chemotherapy is the best, but the owner declined. When the owner declined, we always give the alternate option also. Here's the owner.
This is Ava, and Ava is exactly 1 month out of a kidney extraction. She had her kidney removed by the amazing Dr. Rashid. She has renal carcinoma, and she is doing very, very well. She's really acting. She's a little bit slower than she was before her surgery, but she is eating pretty well. She's running around with her brothers and sisters. Right, Ava? It's about 8 o'clock, so she's a little sleepy.
This is like after 1 month, she sent me the video.
Ava,
This is the Eva.
go. Go get him. Ava,
This is the
go
Eva.
get him. Ava, come on. Ava, come here, show Dr. Rashid how good you're doing. Ava,
So she's doing very well. So far, she's doing very well. And my hospital team and everyone, they are very happy about the outcome. The next patient is my last patient. We have the case number 5th also. I don't think that we have a time for more. I want to discuss this case in little bit more detail. Okay, the Jim Cooper is very interesting case. He came in our hospital in June 21st. He has like something like a, according to the owner, the mouth has infection going on. And when we see the mouth, they have some growth going on, okay. And after examination, we check the blood work, everything. We took X-ray, everything coming back okay. The blood work look okay. And we schedule further to remove the tumor and discuss with the owner also, okay. When I gave a sedation, the owner was standing right there. We want to discuss about that. If you look, the tumor is very big, okay. The owner has so many questions about that, how you want to eating, how you want to drinking, all these things, how you want to maintain the body temperature also, because the tongue also has to regulate the body temperature. And she asked me a lot of questions on that day when I was standing when surgery. And to be very honest, I told him that we're gonna try our best to remove this tumor. Look like very nasty, but hopefully after removing, the James Cooper feeling much better. He will start eating food very well. He know how to manage the food to take, and I think hopefully everything will be okay. The owner is very attached with the James Cooper. She was crying, and she was sitting all day when we do the surgery, and that she was standing there. This tumor is very nasty, a lot of blood supply, and we using with a latest technology, blood vessel sealer and everything. Still, this tumor has a lot of bleeding. We know that this tumor, before we think maybe squamous cell carcinoma, but after removing the tumor, looking like all these things, we know this tumor is very nasty. It's something like a very aggressive tumor. This is after the surgery with suture like everything. And very next day, the owner sent me that this, this is like we put like a feeding tube also, because we know that if he's not eating, at least we have feeding tube. The owner can feed him for a couple of days or maybe week or 10 days until the wound is healed up. We put the feeding tube. This is the feeding tube. And one thing I want to let you know, the feeding tube. We put the feeding tube. After feeding tube, I always take the X-ray to see where the feeding tube. We put like a barium sulfate to see where the tube. And I like to tube right by over the heart. And this tube is by here. So we push him back, bring back by here. And the idea behind right by the heart, that's my mark. Because if we close to the stomach, we see like sometimes they develop like a hernia. Sometimes a reflex, acid reflex also. So we keep him tube back right by here. And after that, it will look, when we make sure that everything fine, we say, yes, okay. We close up everything, we put the tube, everything. And after like 1 hour, the owner came to visit the Jim Cooper. He was standing. She was very happy.
He's standing, right? Good.
It's okay, it's okay. It's okay. Let it come outside.
Oh, good boy. Oh, my baby. You're such a good boy. You did so good. You are
This is we discharged the James Cooper.
wow.
He's going home very happy. This is the next day. The owner sent me the video like a James Cooper. He's eating by himself. Everyone very happy. We are very happy also. She sent me the video clip also that James Cooper is drinking water also very well.
You're so smart. Look at you go.
Everyone is very excited that he's eating and drinking very well. We make a one mistake. We should tell the owner do not give any food and water by mouth. She's starting yet very next day because we don't know about that cause. What kind of tumor is that? We don't know. And we forget that this tumor may be very aggressive. What happened? The stitch broke down. And the James Cooper bleeding very badly, very badly. She called our hospital, my technician, my reception told him that bring him back right away. We see like whole car is full with the blood. She bring to our hospital. My team and Dr. Gus, he knows that bleeding was very, very profuse bleeding. We start working right immediately. My team start working immediately, put IV catheter. I ligate with the clump, with the hemostat to stop the bleeding. And Dr. Gus put like a sedation, everything. We, within 5-6 minutes, we control like everything. We repair everything. And after that, we told the owner, please do not give any food and water until we see the biopsy report. For at least like a 2 week, do not give any food and water until the wound is healed up. She said, that's okay, that's fine. That time, everyone know that if we delay this case, only few minutes, if we delay this case, the dog was expired with a shock. He lose a lot of blood, okay. But we try to give as much as possible. We give the shock dose of the IV fluid, everything. And these are my whole entire team working with that. And after that, the James Cooper is feeling much better, recover. The owner, when she leave the hospital, she write down this word in our reception tag. Thank you so much, James Cooper. And this type of thing, I think, is very appreciated. We recommend the owner to not give James Cooper any water, food, or any medicine by the mouth, only with the feeding tube. We get the report. The report came back very bad. The mast cell tumor. The mast cell tumor is very aggressive tumor. They can spread anywhere, any other organ. And the healing is a major challenge. And also, if you look the report, you can see here the margin complete. To get a complete margin in mast cell tumor is very difficult. Anyone who is a surgeon who do like a surgery or something like, he knows that the importance of the margin. Get like neat and clean margin is very difficult, especially with the mast cell tumor, because they have like a IgE, they have like a Y-shaped antigen with spreading like this, like a shape, like a spreading, like a wide spreading. So there's a board question also, like how much margin you need to take when you're doing the mast cell tumor. I think is 2 centimeter or something like. I completely forget. I don't know. But if I know, this is a board question also, that what kind of margin you need to remove the mast cell tumor. And I'm very happy the margin is very neat and clean. Is everything look okay? And also, the pathologist, whenever they see any kind of tumor mass, they also send the slide, evidence, proof. Everything they send us that what we see in the slide, so nobody can challenge his diagnostic or anything. Okay, if this case go like anything like a board or something like, so he also cover his back. He sent that slide also that this is a mast cell tumor. They send us the slide back. Then we discuss with the owner. We start with the drug medicine is called like a Palladium, is anti-cancer medicine. And I told the owner, please go to the oncologist, take a second opinion, and further treatment is oncologist. He will handle this case. She will go to the oncologist, and they discuss everything. And this is the ultrasound report. Okay, because after looking this, he has a mast cell tumor. I told the owner we need to do the ultrasound right away to see if the mast cell tumor is spreading any other organ. With the grace of God, is not spreading any other organ. Everything's clear. Then I told the owner, please go to the oncologist, take a report from the oncologist, and let's see what the oncologist want to say about this case. The oncologist, he goes for the oncologist, is a board certified oncologist. He gave like a couple of options, all these three options. Palladium, we already start the medicine. And I think the owner after this option chemotherapy every 21 days. And hopefully Jim Cooper has more life, good quality of life. So far is not spreading any other organ, and he's under treatment of the oncologist. And we also checking his blood work, everything routinely. She sent me the picture after the oncologist visit, and she told me that Jane Cooper is doing very well. We just removed the tube this Saturday. Yesterday we removed the tube. This is Jim Cooper owner.
Krista Hastings, and I'm Jim Cooper's mom. About 3 weeks ago, I noticed a spot on Jim Cooper's tongue on one side. The next day, I took him to Dr. Rashid, and he went on a bout of antibiotics. And throughout the week, it didn't improve at all. It got worse. So I took him back last Monday, and that day he had half of his tongue amputated due to a suspected squamous cell carcinoma. Unfortunately, a few days later, he had a hemorrhage, and it was the scariest moment of my life. But I'm so grateful for Dr. Rashid and his team. We got there as soon as we possibly could, and within minutes, he was on the table being stitched up and being taken care of. And a few minutes more, he wouldn't have made it. But Dr. Rashid and his team saved him that day. The past couple of days, he's been so much better. He had some diarrhea for a couple of days, but he's getting so much better. He's getting back to his normal self. He's jumping up on me, wagging his tail. Right now he's resting on the couch, but I'm just so grateful for Dr. Rashid and his team. And I'm so grateful that I still have Jim, and he is a trooper, and he's going to learn how to live his new life under the circumstances. He's just taken a rest, had some food. Bye.
The Jim Cooper owner also reviewed online. This is after 3 weeks. We removed the suture. The healing look very good. Okay, still they have small spot. They need to be more healing. We recommend the owner give her a couple of days more. Then we remove the feeding tube, and we just remove the feeding tube. Just the whole idea behind all these things to explain you guys is that if we do not do a proper diagnostic, or if we cannot handle a proper case in a proper way, the outcome is not very good. We should learn all the diagnostic tools and everything's okay. Unfortunately, in Pakistan, it's very difficult. We are very behind with the veterinary professional. We need to accept this thing. Here in USA, I'm telling you the truth, when I was in University of Missouri, Columbia, my professor, orthopedic surgeon, he teach the human also how to repair the kneecap and everything. And our cardiologist professor, He gave training to the human doctor also, how to put the catheter, everything, pacemaker, everything in sheep. He gave a lot of experiment, hand-on experiment. Here, the veterinary professional is very advanced, and I wish in Pakistan or all other country, they also had the same technique, technology, and student had to learn all these technology, technique, and after that, if they know all the knowledge and everything, they don't need to scare from any stock system or any other veterinary system, anything, because they know the quality of medicine. And I wish the university, UVAS, or all other university, they have to reevaluate their education standard and all the practical courses. And I think the Professor Dr. Neela Durrani this morning, she had a very valid question that we are giving a 5-year training, but we are not focused on surgery, medicine, or pathology. These are the major subject which is coming in practical. In pathology, we have to learn a lot of things, all the tests, which test is very important, which test is which disease. Unfortunately, our pathology department is not teaching up to mark. And I think we have to reevaluate everything. We can discuss this issue later on. And at the end, I want to advise all my students, not my student, all the students who are attending this seminar or who are watching this webinar, please always respect your teachers and parents. That's my first thing. If you want to learn something, always try to learn hands-on experience. Please learn the hand-on experience, okay? That's the most important thing. If you do not learn the hand-on experience, when you go in the practical, you're feeling a lot of difficulty. Try to learn. This is the time. Ask your professor, ask your teacher. They ask them, please guide them. Ask them that I want to learn this thing. I want to learn this thing. I want to learn this thing. They will teach you. And if you don't ask them, they never teach you also. Okay. Always be honest with your client. Always work hard. Always be happy, no matter what the circumstances that. That's my last thing, okay? And I'm telling you one thing, teacher always giving you, no matter at what age of life you are. One of my Professor Javed, he visiting my hospital, and I think that week I had the best week in my life. He's Professor Javed, he's ex-chairman of pathology department, UVAS. He showed me a lot of technique in 1 week, and I learned a lot of things, okay. He diagnosed a lot of things on the spot, and my client, they are very happy. When I introduced, they are very happy to know that he's my professor, he's my teacher. And we have very good time. We visit like a couple of things, Pennsylvania. We have a good gathering also. We have very fun time, and that I want to say that's one of the best week in my life. And at the last, I would like to say thank you. Special thank to Professor Dr. Neela Durrani and the Vet Crescent Society who arranged this webinar. And please, if anybody has any question or concern, I'm open to answer your questions.
Thank you so much, Dr. Ajaz Rashid Sahab, for such a great discussion on evidence-based medicine. Your presentations and videos were so good and definitely made the concept of diagnosis very clear to the attendees. I'm sure this would have ignited the minds of participants for several questions. So if anybody has any question, please write it down in the chat box. I will deliver it to Dr. Ajaz Rashid Sahab. Sir, there's a question from Dr. Uzma. Is there any chances of development of this tumor again in Cooper's case?
Yes, because it's a mast cell tumor, the chance is that they can come back on the same spot or maybe any other part of the body. But we are giving, is under treatment of the chemotherapy, but still, the mast cell tumor is very aggressive. They can come any part of the body. The lifespan with the chemotherapy, radiations, sometimes we see like 1 year, sometimes 2 years. It depends upon like how aggressive tumor and if it come back or not. Let's see. Still, we have a lot of time to watch this case. Is there any other question?
We have another question from Muhammad Usman. What is the vaccination schedule of Lyme disease in dogs and which vaccine is available?
Yeah, we have a couple of vaccination available, but I use the Pfizer vaccine, which is very good. It's called like a Lyme CR, and I see the protection rate is very high. We give the Lyme vaccine 2 doses in the puppy, like a first dose after like 8 week or 10 week or 12 week, and second dose after 3 week, and then every year. And we have the screening test also. We check every year screening test also for the tick-borne disease, that the dog has like any tick bite happen or anything. Plus, we have also prevention also for the tick prevention. They're giving like a monthly, we have monthly dose also, medicine. We have after 3 months, or we have like an application like apply on the back of the neck, e-collar also. This is a big market in USA for the prevention for the Lyme disease and heartworm disease. And people making a lot of money, even with the hospital also, revenue, everything. I hope in Pakistan or all other country, they also starting. Prevention is always better as compared to the disease.
There's a question from Ehsan Ilahi. Kindly share the dose rate of barium sulfate for radiography.
Can you repeat again question?
Kindly share the dose rate of barium sulfate for radiography.
Oh yeah, the dose rate for the barium sulfate, I use like a 15 cc, 15 to 20 cc I use. Just check to make sure that where the tube is that. I don't use like a lot of, because there's some contraindication also sometime if they have any ulcer or anything. Barium sulfate is not good in the ulcer. They cause like irritation also. So I use like a very small dose, like a 15 or 20 cc. It depends on the dog. If it's a small dog, I use like a 10 cc. If it's a big dog, I use like a 20 cc or 25 cc.
There's a question from Ikrar Sabir. Sir, please explain effective chemotherapy combination.
There's a couple of combination. In case of the mast cell tumor, there's the Pladia is also a chemotherapy. We're giving like a Monday, Wednesday, and Friday, 3 days. 1 day off, 1 day on, only for 3 days, once a week, for total like 6 weeks. It depends upon the body weight, and the dose is, I don't remember the dose exact, but when we see the Pladia, they are pamphlet in my hospital, we have attached in our window. There's dose according to the body weight also. We just look the body weight and calculate the dose. Okay, it's very easy. It's not like a very difficult. There's a lot of combination. UPenn, University Penn, they have their different protocol. University Missouri Columbia, where I'm studying, they have different protocol. Every oncologist, they have different protocol. And some of the protocol is very common. And some of the protocol, they're making their own protocol also, the combination of the drug. And plus also radiation, it depends on the radiologist who's a board certified, who want to give the radiation, calculated radiation they want to put on the animal.
Thank you so much, sir, for being so thoughtful. I'm sure all the participants have been satisfied with the topic via your extraordinary discussion, the videos, and the Q&A part. Now I would request Dr. Anila Zamir-Durrani, who is the patron of Vaccination Society as well as Professor of Medicine Department from UVAS Lahore, to join us and have some remarks on the session.
Thank you so much, Dr. Ajaz, Rashid Saab. I am really very grateful to you, but there are few questions, Sajal, in the chat box. I think there are 2 or 3 questions. I would like you to discuss them as well, because after that, then we are going to conclude this session.
Sure, ma'am, I'll read them. There is a question, what about pathogenesis of Lyme disease in dogs? How it reaches to other organs, heart, kidneys, and joints, and why specifically on these sites?
Yeah, that's a very good question, because the Lyme disease basically affect the joint and also the kidney. Sometimes we call Lyme nephritis. When kidney is affecting, then the treatment is very difficult. We have to give the steroid also. We check the blood work routinely. Sometimes we see with the Lyme disease, they completely paralyzed. They cannot walk even okay. Because the treatment is go like a more aggressive. If the Lyme disease affect the kidney, then the chances of survival is very difficult, because the kidney is a major function to filter all the toxin, everything from the body. If the kidney is not working okay, then it's very difficult to give the medicine, drug, everything. And also the Lyme disease, I see very common in USA. I don't know about the Pakistan, but we see very common. And we have a prevention also. We recommend like every client, we educate them for the prevention. We always focus on prevention. Please give the medicine to prevent the Lyme disease, plus the vaccination also, okay? And of course, the Lyme disease affect other organ also, but these are the 2 major organ I see is most affected, joint and the kidney.
There's another question from Muhammad Usman. Is the chemotherapy dose calculated on surface area of animal or the body weight?
So we calculate according to the body weight and plus the surface area also, okay? If we want to do like a, it depends upon the tumor to tumor. Suppose they have a skin tumor and is a multiple skin tumor, and we want to, the oncologist, they measure the size of the tumor, they calculate the dose according to that size, and plus also the body weight. Suppose the dog is like a 5 pound. If dog is a 50 pound, the dose is totally different. The 50 pound dog, definitely they need more dose as compared to 5 pound. And also depend on the surface area also, okay? How big the surface area affected with the cancer. Or if they took already surgery and the tumor is already operated and we're using the chemotherapy, then the most of the time the oncologist is using the body weight. They're not using the surface area. Surface area is only using if the dog has a skin tumor or any tumor exposed in the heart or kidney, and they calculate, first of all, they do like a CT scan, MRI to calculate how big the tumor is that. And after that, that's the oncologist's job to calculate everything. That's not my job. And every professional is interconnected with us, okay? That's why we have a lot of facility which Pakistan does not have. I have like my ultrasound doctor is there, pathologist is also available, ultrasound diagnostic tool. I have like my orthopedic surgeon, Dr. Ting, who's do like a orthopedic surgery. I have like a heart doctor, Dr. Keegan, who's coming in our hospital to see the heart patient. And also same, everybody is interconnecting each other to help each other. Then it become like a good quality of medicine. It's not like only me, I can do everything. No, I'm not doing everything. That's not my job. Oncologists have to do their job. I have to do my job to diagnose the disease, to treat them, to handle them. If I can handle that surgery patient, that's okay, that's fine. If it's a complicated surgery, then I refer to specialist also. The soft tissue surgeon is available in my hospital, and the orthopedic surgeon is also available. Then they have to do the surgery, not me.
Another question from Amna Iqbal. Kindly tell us about treatment and management protocol for Lyme disease.
Yes, the treatment protocol which I'm using and most of the university using, we check the blood work when we diagnose the Lyme disease. First of all, we check the blood work to make sure the kidney is working okay and the liver is working okay. These two organs is a major for the treatment of the Lyme disease, okay? Because we need to get the pain medicine, and all the pain medicine, they absorb, metabolize through the liver. And if the liver is not working okay, then we have to think about the different pain medicine which is not affecting the liver mostly. Then we have to use like a gabapentin or any other pain medicine which is not affecting mostly of the liver. And same thing, after checking the blood work, if we see the kidney is okay, the kidney is fine, then we hope the dog is not Lyme nephritis. Then we send home with a doxycycline, is a drug of choice, is the most effective, is 10 milligram per kilogram. You have to give morning and evening with the food, because doxycycline also causes like nausea, vomiting. Make sure you can add like anti-nausea medicine also with the, if the dog has a problem with the nausea and vomiting, we add like an anti-nausea pill. Doxycycline and the pain medicine, I send them with a Ramadol or Pervicox. It depends upon the dog. Ramadol is very commonly used, and also gabapentin. If the dog is feeling more pain, then we add like a tramadol, opium also. It depends upon the case to case, but the major medicine in the Lyme disease, which is treatable, is with the doxycycline. Doxycycline is a drug of choice in the Lyme disease. And they will ask this question in the board also. That's a very good question. Thank you.
There's a question from Dr. Ismail. Is there any advancement in treating feline panleukopenia virus over there?
Can you repeat again?
Is there any advancement in treating feline panleukopenia virus over there?
Yes, I discussed like a feline panleukopenia, like a cancer of the white blood cell, and the AIDS virus and FIP. There's no treatment available. They are very fatal virus. Only the supportive treatment we are giving if the patient is diagnosed, especially with the feline leukemia virus. If we diagnose the case, first of all, we educate the client, because this disease is very fatal. It can spread to the other pet. It's better we need to put them down. They can spread through the saliva. They can spread through the air foam also. Yeah, the sharing with the ball, sharing with the feeding also. There's a most fatal disease I see, and we highly recommend. There's no treatment as far. It's better to put him down.
Thank you so much, Sajal. I am really very thankful to Dr. Ajaz Rashid Sahab for his time and for the way he has presented all the cases in a very understandable way. I am also very thankful to Professor Dr. Naseem, our Vice Chancellor. He has always been very kind and is always there with us whenever we are trying to get some event done. He is always very encouraging and very motivating for the students and for the faculty as well. We have with us in the audience Dr. Ishad Hussain. I am really very grateful, sir, for your presence. And we also have Professor Dr. Akram Munir with us. He is also teacher of Dr. Rashid. So, sir, if you want to conclude this session, I would feel very much honored if Professor Akram Munir could conclude this session. So just see if Akram Munir Saab's mic is unmuted. And lastly,
Yeah,
I'm also
thank
very
you.
thankful to the son of Dr. Ajaz Rashid. He is also my son as well, and we are also very thankful because he has given a lot of time in preparation of all these slides. I was asking Dr. Ajaz Rashid for a few comments from his son, but he said that he is very shy. So all of our
Okay.
appreciation is
Should I speak now? Can I
yeah,
speak?
sure,
Yeah.
sure, sir.
Dr. Anila, thank you very
Yeah,
much.
sure, sir.
I'm thankful to the Vice Chancellor, Dr. Naseem Ahmed, Dr. Rashid, my student, and my son. And there are certain gaps in education here, um, and they are mostly reflected by our talking to the people. Dr. Rashid says that this is basically a joint effort to go for surgery. He's talking about the pathologist, he's talking about the radiologist, he's talking about the skills of the surgeon, he's talking about the post-operative care, and many things others. So what I believe is that wherever the gaps are, he has very rightly told us, at least we need to think about them and we need to do what practically is required. And for that purpose, I would also suggest to the PVMC if there are certain changes to be made for teaching in the subject of surgery, in the subject of pathology, microbiology, radiology, even the anatomy, cardiology, vaccinology. So actually, Dr. Rashid has talked about every subject. So I hope that this presentation will go a long way for the students of UVAS, for the students of other universities, and for the students of Rifa Veterinary Sciences College. I believe there is always room for learning. But in Pakistani culture, we have always very big room for learning. The people in the developed nations have gone too far in surgery, too far in pathology, too far in microbiology, whereas I think we are little behind. And probably if we put in our efforts, we could match them. Of course, we lack in facilities, but whenever we go abroad, we are able to use the same facility. Dr. Rashid, most successful surgeon. I have seen him in his clinic. I have been to his hospital. He is the most popular person there. So I would suggest that what the Vice Chancellor takes a note of it and he can order some of the changes if needed in the curricula of teaching of DVM. Thank you very much.
Thank you, sir. Can I say something like before we go? Thank you, sir. Professor Dr. Kamanir sir is not my teacher. He's just like my father. And also, I'm glad to hear that Dr. Arshad sir is also my teacher. And I'm thankful everyone who attend this seminar. And special thank Professor Dr. Neela Durrani and Vet Crescent Society and all other professors from different universities all over the world. And my colleague, Dr. Gus is also here. And everyone who attend this seminar, please, I really appreciate all of you guys giving the time. And hopefully we will continue this this type of seminar. And I will try one of my friend, he is also a professor. He teach in University Agriculture Faisalabad, and he's a very good surgeon also here. His name is Dr. Akhtar. Dr. Akhtar is very good doctor, very good surgeon also, physician. He's working in Banfield Pet Hospital. Next time maybe I will request all our. I have a connection with the Professor Javed and all other doctors who working in the USA. I will request at least give some time to prepare some lecture, to prepare some slide to show the students that how we working in USA. So step by step, they can learn something. At least they can learn something. At least they know what's the importance of the blood work, what's the importance of the X-ray, diagnostic, all these things. And I really appreciate everyone. And I apologize if I miss anything. And I cannot handle everything in very short time. I try my best. I hope you guys like it. But next time we will prepare more because my staff was very busy. A lot of slide is missing in my this seminar. But my son, I think, did very well job. And he prepared like all the slide, everything within 2 or 3 days. And thank you for everyone. And please accept my regard and love to all but everyone. And see you next time. Thank you.
Thank you so much, sir. Now I would request Dr. Zia Mughal to join us and have some remarks on the session.
Bismillahirrahmanirrahim. Thank you very much for giving me this opportunity and considering me to this level. Sir Ajaz Rashid Sahab, sir, thank you very much. It was super wonderful, and we learned a lot of things which we normally do not. And a lot of thanks to my teachers, Professor Neela Saiba, and the doctors, others, my colleagues as well. Sir, there's only one thing which I just wanted to share regarding the treatment of FIP, when it's clinical form. So here in Pakistan, we are treating that successfully, and it's working very well so far. I have treated 4 cats, only 4 because the treatment cost is quite expensive. Pakistani rupees. The whole course of treatment for one cat, it goes to around 300 to 400,000 Pakistani rupees, and not everybody can afford that. So 4 people so far, they came up with the treatment, and they did afford, and that has been very successful. There's a new drug called as remdesivir. You must have heard of that. It's the same drug which is being used for the COVID-19 treatment in humans. However, the salt is a little bit different, but it's exactly the remdesivir. So we are getting it from USA, by the way, and it's not registered by the FDA. Is not approved by them. So what we get is from black market. If you would like, I can share the links and some of the articles with you, and so far it seems like quite successful. So yeah, that's the only thing I wanted to share. Otherwise, sir, nobody can match your experience, and of course we're just kids when it comes to the practice. We're still learning, and we are super thankful to you for taking time for sharing all the valuable experience to which there's no match. And I really appreciate, and thank you very much, sir.
Thank you, Dr. Zia. I really appreciate your all the concern and everything. And yes, I know that this treatment also available, but here is something like a problem. We have a rule that's very good. That's very good. That's wonderful. But some of my colleagues, they did not see like a very successful rate also. Okay, but if the drug has a very successful rate, and of course we can try also next time in our patient. Thank you for your information, and your achievement is very good. And I really appreciate anybody who tried something like anything who want to discuss. They're the most welcome. This is the way we learn each other. Okay.
And the other thing, sir, there was a question before. If you allow, with your permission, I would like to share, a thing about that. That was treatment of Lyme panleukopenia. There is a drug called as Filgristin is the name, is the generic name. With that, we are a little bit more successful than usual than before for the treatment of that. It's basically it induces, like, more production of the neutrophils, so it induces neutrophilia. This is the main issue in FPV, feline panleukopenia. This is just one more thing which I wanted to share. This is regarding the question from Dr. Ismail from Lahore. So he was asking. So I don't know if that's being used there in USA or not.
The thing is that I don't know if you see any success rate or something like, and most of the time I say the feline leukemia,
Panleukopenia, sir.
Yeah.
Sir, it's panleukopenia, FPV.
Yeah. It's like the same virus, like these are the three viruses: the AIDS virus, and feline panleukopenia, and the FIP. They are belong to a family. They are very fatal, and if you have a success rate, I think that's very good. But most of the time, the problem is that the disease, how the disease spread, okay. And this will spread like very fast with the saliva, with the sharing of bowel. And most of the time, we don't want to take a chance to spread the disease also, okay. And we try to recommend the owner, please, we can euthanize like a human way. And most of the time, they accept this option.
Right.
Yeah, if there's any chance, okay, we will try. But the thing is that is contamination over our hospital and all these things. A lot of things we have to keep in mind also, okay. We have to save the other pet also, other animal also, and we try to maximum do not spread the disease very fast, okay.
Right, sir.
Here the population is a lot, okay, maybe in Pakistan or something like, and we recommend like we have a shelter, we have like a homeless animal also, they can adopt from there, and most of the time they will be okay, they are fine. Of course, some of the pet owner, they are love their pet, they want to spend anything. Even I have a case, they transplant the kidney also, and they go far, and they don't care about the money or anything, okay, and they love too much. And if this option is working very well, I think that will be good, and we will consider later on.
Right, sir. Thank you very much, sir. I really appreciate it. Over to you, Dr. Sabha.
Thank you so much, sir, for being so thoughtful. Now, before concluding this webinar, I would like to thank you all for joining us. The way you eagerly attended a session shows that your craving for knowledge took you all here to be a part of this informative webinar. Especially, I would like to thank our Vice Chancellor, Professor Dr. Naseem Ahmed, our guest speaker, Dr. Ajaz Rashid, Professor Dr. Anila Zamir Durrani, Professor Muhammad Akram Munir, and Dr. Zia Mughal. I highly acknowledge the participants for their attention and patience. Thank you so much for joining us and making this webinar a success. Have a good week, everyone ahead. Thank you.